Hair transplant surgery is used to treat men who are suffering from thinning and balding. In most men, hair loss is caused by dihydrotestosterone, or DHT. This is a hormone that causes hair to thin and eventually fall out. This type of hair loss is commonly seen as male pattern baldness. In those suffering from this condition, hair is initially lost in the temples and the crown, but with age can progress to include the entire top part of the scalp. However, hairs on the back and side of the scalp are completely resistant to this hair loss process. So, when hairs from these regions are surgically transplanted to their new location, their growth can last a lifetime. At the treatment rooms, our surgeons meticulously assess your hair loss and work with you to create an individualized treatment plan to restore hair in areas of balding. One preferred surgical method is follicular unit excision, or FUE hair transplant surgery. This technique uses a circular surgical punch to cut around each hair follicle individually. This releases the hair root from the surrounding skin. Each follicle is then lifted out, using great care to protect it. Incisions are made in the target area of scalp, controlled for hair depth, angulation, direction, and density. Each hair is then reinserted individually. The whole procedure is performed under local anesthetic, allowing you to sit back and relax. The donor area from where hairs have been removed heals with dot-like scars, less than 1 millimeter in diameter. Usually, these scars cannot be seen when the surrounding hair grows to a grade 1 or 2. After 1 to 3 months, the newly implanted hairs will shed before growing again in 4 to 12 months. This is when the full hair transplant result can be seen. Results should last for over 20 years and potentially for a lifetime.